Hi everyone, I'm Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel. If you're new or a regular viewer that has not yet subscribed, please make sure you do subscribe. Also, make sure you follow me on Instagram. Link is below. And don't forget, you get access, all of you can now have access completely free copy of my book. Link is below also in the description box. Go ahead and snag your copy and enjoy. It is a fantastic read, and many of you have already read it and love it. Having said it, for today's video, I will be discussing fear that you may experience starting feminizing hormones in regards particularly to what may be perceived as immediate breast growth, and what that fear is about, and give you a little bit of a cautionary thing, if you will, or just some advice and feedback, because I've seen this with so many of my individual clients. So this is going to be specifically about feminizing hormones. So if the feminizing hormones is of no interest to you, please feel free to not watch, obviously, this video. When individuals go on feminizing hormones, a lot of times, the client that I work with, at least, a lot of times, a lot of my clients do start on feminizing hormones before they even come out, before they even step into social transition. And one of the main reasons, and I talked about it in a video not too long ago, one of the main reasons why we do feminizing hormones first is first and foremost, to alleviate gender dysphoria, to alleviate that mental angst, that mental turmoil, to quiet down the noise, to create a space of inner clarity from which then a person can make better decisions, can make more clearer decisions to move forward. And another reason why feminizing hormones is a great way before even social transition is because the changes are going to take a while. And for that reason, none of the changes are going to be so apparent where a person can continue their lifestyle without anybody asking questions or without anybody kind of raising an eyebrow, if you will. And so it becomes a really good way to move forward with trying to alleviate the stress without really stepping into too many of the changes. And while unfeminizing hormones changes do take a while for majority of people I work with, because I work with a lot of adults, one of the changes that I repeatedly see people experience that freaks the heck out of them and makes a lot of my clients even think that maybe they should stop taking hormones, apart from already experiencing psychologically positive physical changes on feminizing hormones, is breast growth. Now, I want to explain what I mean by breast growth, because in my experience, majority, and I'm not saying this for every single case, right? However, for a big segment of adults I work with, what they perceive and see as breast growth is actually what's end up happening is, I call it nipple budding. It is when a nipple buds out, and it buds out and it feels like immediate huge breast growth. Well, not huge, big breast growth. It becomes incredibly sensitive to the touch, to the point maybe even taking a shower and having water drip down on the nipple might be incredibly sensitive. Hugging people can feel very sensitive or even painful to the nipple touch. So it's almost like, if you think of a breast, okay, if you think of the breast as a flower, it's like that first bud, that budding out. And then the more you expose to estrogen, it slowly starts to open up and hence become a bigger breast. But that first breast budding is what scares people and gives an impression that, oh my God, the breasts are growing faster than anticipated. I'm not out yet. I haven't even told anybody around me. I can't now. I'm afraid if I wake up tomorrow, it's going to get even bigger. Then there's going to come a point when I can't even go to work and wear masculine clothing, wear masculine short. People are going to be wondering why I have what people call man boobs. All of the things are very common, and they catapult individuals into anxiety, catapult into ruminating thinking, catapult into fear and stress about body changing so fast, especially breasts, right? Breasts are such feminine trait, feminine characteristics, growing so fast that, oh my God, people are going to be wondering what the heck is going on with me. And the truth is, all it is in majority of the cases is just bubbling off the nipple growth. And after a week or 2 weeks, it plateaus, where all you have is that budding of the nipple, and you're not really seeing any additional growth of the breast. And that's because, it's that initial, it's almost as if your body has this initial wave and taste and exposure to estrogen, and you suddenly have this nipple budding. After that, it slows down. And after that, it tapers down. And then it's really depends on how your body metabolizes the hormone from then on and a lot of other factors, right? So for some people, it becomes slow growth. For some people, it's just very, very slow. Personally, I've been in this field for 20 years and I work with adults only. I have personally, this is just my experience, and this doesn't mean that this is everybody's experience. I have yet to see a person who has achieved a very large breast size on feminizing hormones alone at an older age. Usually, individuals achieve, I would say, like B, sometimes somewhat close to B plus, C size. A lot of times people will be less satisfied with the shape of the breast because it will be more cone-shaped versus the actual size. And it's usually the shape of the breast that makes a lot of people decide to get breast augmentation because they want it more rounder, more teardrop, more of that rounder appearance of the breast. But even to achieve a B or a C size, in my experience with clients I worked with, that took 2 to 3 years. So we're talking about a long period of time. I'm not saying that it's not possible, but it takes time. In my experience, to say that people have gone on feminizing hormones as part of their first step and have not yet socially transitioned and had experienced large breast growth within 2 weeks, 1 month, 2 months, 3 months would be inaccurate. I have never seen this happen. Doesn't mean it doesn't happen, but I have yet to see it, so I have to go off what I have seen. So the reason why I'm making this video is because I see so many people freak out with the nipple budding and then they stop. And it saddens me that they stop because a lot of people get such positive effects, psychological effects of being on feminizing hormones, where they don't feel the dysphoric angst. They feel like finally they can think clearly, they can see clearly, they feel so much better. And so it just saddens me that here's something that helps alleviate dysphoria. And I also understand that people really get scared because they're not out yet. And I know that a lot of people watching it are starting hormones first before coming out, which I also recommend, by the way, to a lot of people. If that fits your circumstances, that's also one of the options. I have a whole video about it. So I want you all to be mindful that you may have the breast budding growth. It doesn't mean that you're suddenly going to wake up with large breasts, where no matter where you go, people will think you have breast. It just means that you're having breast nipple budding, that initial first stage, and that there's a very high probability that things are going to plateau or things are going to slow down. And this is what I consistently see. I consistently see things slowing down for people. If it is such a huge concern for you, but psychologically you also feel so much better and you want to continue, there are also other options. So if it's such a concern, I've seen people who would start binding, for example, underneath the shirt, just like transmasculine folks bind in order to flatten the appearance of a chest. I've seen people resort to wearing baggier clothes or people wearing sports bras underneath. There's all of those options too. I don't want you to feel like you need to completely give up feminizing hormone therapy, especially if it's helping so much with alleviating gender dysphoria. And if you are not ready to come out yet, that's valid too. But just know that there are things you can do. There are options in place. And also know that that initial nipple budding is oftentimes all it is. It's just a nipple budding. And then eventually it subsides and everything just slows down. Anybody who's older adult who've been on feminizing hormones most likely have experienced this, because I just see this again and again and again. So be mindful of that. Last thing I want is for people to get so scared and so overwhelmed that, like I said, they just give up altogether. Because then you're going back to continue to live and struggle with gender dysphoria. And oh my goodness, we all know how it's, first of all, it's not sustainable, how painful that is. And I don't want any of you to be in pain. So if you're thinking about feminizing hormones as a first element of your transition before even coming out and you experience nipple budding and you're freaking out, take a pause, give yourself at least another week or 2 weeks, see what happens. You're not going to wake up with, I always say this, nobody's going to just wake up with like double depressed. It doesn't happen like that. The body doesn't respond that way to hormone. It just doesn't work like that. So think about it like puberty, right? Even though I hate to compare it to puberty, but think about it just like a puberty, right? So when a girl goes through her first menstrual cycle, that's what happens too. Nipple pods out. And it feels like, oh my God, my breasts are growing, they're getting so large, but it takes time. It takes time for the girl to achieve whatever it is in her genetic composition, to achieve particular breast growth. So it doesn't happen overnight, and it's not going to happen overnight for you. So if you're freaking out, if you're scared about it, if you're scared of the outcome, keep that in mind. That's just not how things work. So comment below, let me know if you've been in this position, if that's something that scares the heck out of you. I've had clients who are really freaked out by it, and I don't think there's anything to be freaked out about. And also keep in mind, there are options and solutions in place. Comment below, let me know, and I'll see you all next time. Goodbye.